Agenda item number 2. The role of Chinese medicine services in primary healthcare, CM services at the district health centers, and interprofessional and cross-institutional collaboration for CM services. Members who'd like to speak, please press the button. I'd like to ask the administration to walk us through the papers. Dr. Fan, thank you. Good morning, Chairman. Good morning, members. Agenda item number 2, we're going to look into the role of CM services in primary healthcare alongside the enhancement of CM services and interprofessional and cross-institutional collaboration for CM services, covering TCM practitioners and the referral between TCM practitioners and medical institutions. Over 90% of TCM practitioners are working in the private sector. They are working in NGO, chain clinics, as well as private clinics. The government provides support to members of the public to access CM services, including Chinese medicine clinics, training and research centers, and 800,000 annual quota of government-subsidized outpatient CM services, and so on. All these are very much well received by the public. Through DHC, the government provides clinical CM services to members of the public on a funded basis. There is also the elderly healthcare voucher scheme to allow elderly people to choose primary healthcare services that are suitable for them, which include TCM services. Under the primary healthcare blueprint, the government will continue to enhance the role of TCM in primary healthcare and to promote interprofessional and cross-institutional collaboration for CM services. More TCM practitioners will also be encouraged to register in the register, and they are also encouraged to use e-health. TCM elements in district health centers will be enhanced. For example, we will provide TCM services for women at the Women Wellness Satellites. We will also enhance services provided to elderly people in society. We will strengthen the use of TCM in Hong Kong in relation to interprofessional and cross-institutional collaboration. Physiotherapists, occupational therapists, radiographers, and medical laboratory technologists can receive referrals from TCM practitioners under the Allied Healthcare Professions Ordinance. There are guidelines for registered CMPs on referrals for diagnostic imaging and laboratory tests, as well as referrals to healthcare professionals. The CM development blueprint will provide concrete proposals in relation to interprofessional and cross-institutional collaboration for CM services. Referrals mechanisms will be put in place to enhance the interface between Chinese and Western medicine. Details have been set out in the discussion papers. My team and I are happy to take members' questions. Thank you. Thank you, Undersecretary. 2 members have pressed the button to request to speak. They are Mr. Andrew Fan and Ms. Rebecca Chan. And myself. In the interest of time, each member will be given 4 minutes, including answers by the administration. First member, Mr. Andrew Fan. Thank you. Thank you, Chairman. I thought I would have more time, but all right. I'd like to ask about treatment of TCM. 2,600 TCM practitioners are listed in the primary care directory. I'd like to know why only 2,600 and less than half of those are under the elderly healthcare voucher scheme. Has the administration looked into the reasons why TCM practitioners are not willing to sign up in the directory? If there are more TCM practitioners providing services, this can ease the pressure on the local public healthcare system. In paragraph 14 of the papers, it touches upon the fund, that is TCM Development Fund. and this will enhance exchanges among different healthcare professionals. As I understand, when it comes to Western medicine education, little has to do with theories about TCM. If you only rely on a few lectures on TCM, is it really possible to achieve the complementarity between Western and Chinese medicine? How can the administration enhance exchanges and training across professionals in the Western medicine sector and the traditional Chinese medicine sector? We shouldn't just rely on referrals. Thank you, Under Secretary. Thank you, member, for your questions. First, regarding district health centers participation, I'd like to ask the DHC to give you more information in detail. Regarding training, CM Development Fund, of course, will provide support in this regard. But when it comes to training, I will also ask the Commissioner to analyze for you. Thank you. Regarding TCM's practitioners' participation in the primary care directory at DHCs, our operators are actively inviting professionals to join the DHC. They are actively building a network of TCM practitioners. They buy services from private practice TCM practitioners. This enhances the network at the DHC. For the existing network, we're providing treatment to patients of back pain, stroke, and knee osteoarthritis. Regarding TCM, practitioners need to sign up at eHealth first before they can join our network, and this is probably one of the reasons turning them away. As we discussed in the last agenda item, we have been providing assistance to TCM practitioners to upgrade their IT facilities in their own clinics. The purpose is to encourage them to sign up for the eHealth so that they can break the barrier and then they can join our network. As a result, they can join the PCD, that is Primary Care Directory. Thank you. Next member, Ms. Rebecca Chen. Thank you, Chairman. Regarding TCM services in primary healthcare, of course, I support it. TCM practitioners in Hong Kong, we have enough in Hong Kong. They can provide services for members of the public in Hong Kong. The purpose of TCM is preventative treatment of diseases, which coincides with the purpose of Western medicine, that is, prevention is better than cure. So I'd like to see an enhancement of TCM services in primary health care. In the blueprint or in the discussion papers, TCM practitioners make up one single unit. I can share with you one real-life experience. We need to make good use of NGO's mobile TCM trucks. So what are their purposes? I once made an arrangement to arrange for a mobile TCM truck. The truck can be parked at a meter, but then they need a power socket. They need to have electricity in order to power the CM mobile clinic. In a village, probably it's difficult to look for a supermarket. There are probably more real estate agencies than one single supermarket. Hong Kong is facing an aging population. If you ask members of the public to take transport to a clinic for preventative treatment, they may not want to do so. However, if they have a CM mobile clinic nearby, they can make good use of the elderly healthcare voucher scheme. I can see that they are more proactive to seek treatment, including preventative treatment. This topic is on the role of TCM services in primary health care. Can we provide more CM mobile clinics so that we can leverage the role of TCM when it comes to preventative treatment of diseases? This can help primary healthcare services. Regarding interprofessional and cross-institutional collaboration of CM services, earlier on in Council, we passed legislation. TCM practitioners can refer patients to allied healthcare professionals. It all comes down to the authority or power of TCM practitioners. If TCM practitioners can refer patients to MRI, X-ray scan, CT scan, that'd be better. However, for registered TCM practitioners working in the private sector, they cannot do so. If TCM practitioners do not work in Chinese Medicine Hospital of Hong Kong, it'd be difficult. Only those working in the CM Hospital of Hong Kong can make such referrals. That is why we need to take this into account. We need to have a timeline to allow TCM practitioners in the private sector to refer patients to other professions. This is exactly how we can promote cross-institutional collaboration. Dr. Fan, thank you. We've heard your view. Regarding the implementation of a policy, we need to work with the district. We keep our mind open. We want our services to reach different categories of patients or members of the public. At present, DHCs are partnering with a lot of different operators. As for Chinese medicine clinics, training and research centers across 18 districts, they are NGOs, in fact. So we'll see how we can work hand in hand with NGOs to chart our way forward. We'll look into how we can enhance our services in the future. Regarding referrals, I want to ask Dr. Mack to give you more information about what we're doing at present. Thank you.
Thank you, Chairman. Thank you, Mr. Chan. As Mr. Chan said, regular CMPs now can refer patients for X-rays. This is just the first step. CMHHK provides a platform for us to trial out different models. This is how we can promote different service models step by step, safely. In the CHHK, CMPs can refer patients for many different tests. Through accumulating experience in the Chinese Medicine Hospital in Hong Kong, we can think about how we can further promote this referral mechanism. This has to do with training of CMPs. We need to train practitioners that have not undergone university education, say for example, and this takes time. We will review the service model after CMHHK is commissioned for 1 year before we promote the referral mechanism to the private market. I understand that a few universities train their students in Chinese medicine. Apart from X-rays, now CT, MRI, imaging services have not been opened for referrals. Many registered CMPs have undergone professional trainings. They are licensed. So I hope that we can come up with a timetable as soon as possible. If we can implement such a referral mechanism, we can alleviate the manpower pressure in the Western medicine industry. This will also help patients seek help in a more speedy manner. We discussed this last time. We hope that registered CMPs, apart from those stationed in CMMHK, can refer patients to other diagnostic testing, because these tests are essential to diagnosis. Only after these tests have been conducted can a doctor diagnose a patient before referring them to, say, for example, other professionals for treatment. I hope that we can have a timetable. That's a comment. No need for a reply. The key is the timetable. Because the law's been passed, we don't have a timetable yet. This is to safeguard the diagnostic right to a diagnosis of the members of the public. I hope that this administration will speed that up. Next, Reverend Peter Kuhn. Thank you, Chairman. I'd like to follow up on the referral mechanism, too. I may not fully understand it. Now, say, for example, for X-ray, CT, CMPs are not trained to read those results. If CMPs want to refer patients to other professionals to conduct X-ray or CT scans, should we not allow them to do that? What's the challenge? If the CMPs is of the view that they cannot treat the patients, should they not be allowed to refer them to physiotherapists, for example? The risk is minimal, because after referral, other allied health professionals are to conduct the treatment. Should we not relax the restrictions on interprofessional collaboration? Thank you. All professional healthcare practitioners are regulated by their respective code of practice in providing suitable healthcare service to patients. On referral mechanism, there is regulations of that in the law. Before the Allied Health Professions Ordinance have been renamed, it used to be a Supplementary Medical Professionals Amendment Ordinance. These allied health professionals can only receive referrals or take referrals from Western doctors. Now we have relaxed the restrictions by amending the law. Now allied health professionals can take patients referred by CMPs. For radiographers and medical laboratory technologists, they can take patients referred by CMPs. Previously, they are restricted as to what kind of patients they can take under the referral mechanism. If a patient needs to seek help from an optometrist or nutritionist, speech therapist, patients can seek help from them directly. Chairman, I understand that as the administration is trying to relax barriers by amending the law. Well, you just mentioned X-ray. Of course, someone needs to be trained in order to be able to read it. Can we allow CMPs to make such referrals in the private market? A quick response. Thank you. The CMP need to assess their own professional knowledge as to what they can do. When the laws was amended, the Chinese Medicine Council came up with the guidelines. And that's a guideline the council came up on their own together with the trade. The liabilities, the action plan are clearly set out in the guidelines. Thank you. Now it's my turn. I'm sure that all of you understand the advantage of Chinese medicine in preventing diseases. In all 18 DHCs and CMHK, many elderly go to these places with the healthcare vouchers. It seems that Chinese medicine is very popular, but the role of CMPs in primary healthcare is limited, especially with DHCs. According to paragraph 2 of the paper, only 600 people receive care from the DHC on pain management. So only 33 people per DHC benefit from the voucher system. So will the administration and increase the KPI for DHC so that more people can receive care? According to the administration replies to an oral question from the member in January, we don't have CMPs in the establishment of DHC. So will the administration ask the operating organization include CMPs in their establishment of DHC so that they can play the role of a hub to better support CMs in providing network services? In order to enhance the role of CMPs in primary healthcare service, can we implement this principle of one Chinese medicine practitioner for all to encourage members of the public to seek help from CMP? Thank you for the question. First, on patients receiving Chinese medicine services in DHC for pain management and stroke rehabilitation. We may not be able, well, we perhaps should not divide the total figure by the number of DHC. I will ask my colleague to supplement. We need to do it step by step. We make arrangements in accordance to the demand level. I will ask the Primary Healthcare Commissioner to explain that. Now, the member talked about this concept of one CMP for all. In March, we rolled out this primary healthcare co-care network. We want to encourage people to use DHC as the starting point. When people visit the DHC, we will conduct risk assessment for them. We will have regards to their health conditions and provide advice to them. We may advise immunization for them. We may suggest them to manage their weight. We may provide them with blood pressure screening, type B, liver disease. We may ask them to go for a surface check, colonial cancer screening test, so on and so forth. We want to build a community network. Very soon, we will include community pharmacy function in the district health centers. Pharmacists can play their role. First, Chinese medicine practitioners, we try to engage them in the DHC as well. We will definitely strengthen our subsidy. The head of the PHC, please. Thank you. Now, in the DHCs, we offer pain management program and stroke rehabilitation program to members who are post-stroke or who suffer from knee osteoarthritis or back pain. Now, we work with allied health professionals and CMPs in developing a network. We adopt a co-payment model with the members so that they can receive personalized Chinese medicine service. For members who are post-stroke or those who suffer from knee osteoarthritis or back pain, we offer them with subvented service, including acupuncture and acupressure treatment. CMPs, apart from providing these personalized service, will also offer health education services. In order to highlight the advantage of Chinese medicine, the government will continue to review the service directions and strategies of Chinese medicine primary healthcare service. We will also further engage the private Chinese medicine trade in our strategic procurement to strengthen interprofessional collaboration. Through various training and promotion, health assessment, and care, we are now engaging more Chinese medicine practitioners on chronic illness, co-care, and health management. The member asked if we should include CMP in our establishment. Now, a DHC has included the CMP in their establishment. That's our first step. Dr. Fan just mentioned about this. Say, for example, women's health. We have included a strong CM element in that. This year, we're going to integrate CM elements into our elderly service. We believe that there will be many more CM components included in the DHC this year. Thank you. Next, Mr. Thomas So. Thank you, Chairman. Some of my questions have been put by the Chairman, but the trade wants to make 2 points. Let's see if there is a reply from the administration. It seems that we ought accept that there are some conditions where Chinese medicine have distinct advantage, say for example, stroke, rehabilitation, chronic pain. Just now we talked about whether CMP should have the power to refer their patients to other allied health professionals. After Western medicine hospital have treated a patient, if they are of the view that the patient need to seek rehabilitation service, is there a mechanism for these Western doctors to refer their patients to Chinese medicine practitioners? That's my first question. That's a suggestion as well. Now we're talking about integrated Chinese Western medicine. I'm sure that we need to foster mutual understanding. We need to alleviate the misunderstanding that Western doctors have against Chinese medicine practitioners. Are we going to mandate the Western medicine undergraduates to study Chinese medicine in the undergraduate program? Should we teach undergraduate medical students about Chinese Western medicine collaboration?
Undersecretary, thank you. You want to ask more about our services? I'd like to ask Ms. Wong to give you more information. She can walk you through the referral mechanisms and so on. Patients should be allowed to access both Western and Chinese medicine. Well, both CUHK and HKU Faculty of Medicine include TCM elements in their curriculum, so the students will learn more about TCM at school. Ms. Wong, thank you. In a lot of treatments, we can see TCM is useful for patients, say for post-stroke care. Under the HA, we have integrated Chinese Western medicine projects. We use both Chinese and Western medicine to formulate a treatment plan. Acute period, rehabilitation period, or discharge from hospital, we have arrangements as well. The clinical framework has a clear division of labor between Chinese medicine practitioners and Western medicine practitioners. Therefore, the advantages of either medicine specialty is leveraged. Upon discharge from hospitals, probably from hospital to discharge, then patients can continue to receive TCM services in Chinese medicine clinics, camp training, and research centers. Just now we talked about how TCM services can work together with Western medicine services. In the past decade, the hospital authority organize TCM courses for Western medicine practitioners regarding collaborative projects. We have seen participation from the Western medicine sector. We have had good communication and good coordination. Thank you. Next, Mr. Andrew Fan, second round. Thank you. Just now I asked 2 questions, but my second question was left unanswered. But Dr. Thomas So has already asked a question that I wanted to ask. I'd like to say something. When a patient is cured, the patient can be referred back to the Western medicine after receiving TCM services. Take COVID-19 pandemic as an example. Patients benefit hugely from TCM services. A patient should rely on TCM to strengthen the constitution and foster vital energy. But under the existing mechanism, there isn't much about this. I'd like to know if this can be provided in the future. Thank you. Before we proceed to agenda item 3, Ms. Long and Dr. Mack will leave us. Agenda item number 3, services of the Chinese Medicine Hospital of Hong Kong and its role in establishing and promoting Hong Kong's Chinese medicine service model. Members would like to speak, please press the button. I'd like to ask Undersecretary to take us through the papers. Thank you. Thank you, Chairman. Thank you, members. The third agenda item today is services of the CMHHK and its role in establishing and promoting Hong Kong's Chinese medicine service model. Before the commissioning of the CMHHK, the Hospital Authority in 2014 introduced TCM services in secondary and tertiary tiers of public healthcare services, say stroke care, cancer palliative care, musculoskeletal diseases, pain relief. Patients receive integrated Chinese Western medicine services, and in 2023, such services have been regulated. These services will continue to be expanded in relation to the type of disease areas as well as service locations. There will also be more services such as knee osteoarthritis issues as well as other ailments. We'll continue to develop such services. CMHHK provides CM predominant pure CM services as well as integrated Chinese Western medicine services. And CMHHK now provides inpatient and day patient services. Later on, the CMHHK will provide 24-hour inpatient services, and it will also focus on providing secondary and tertiary services. It will leverage the principle of specializing in specialties and strengthening special diseases. CMHHK will strengthen its clinical operation through integrated Chinese and Western medicine and cross-professional collaboration. CMHHK will accumulate more experience to develop CM predominant services in Hong Kong. CMHHK is a flagship organization of TCM services. It shoulders different responsibilities for teaching, research, treatment, and so on. There are a total of 5 core areas. CMHHK has been establishing partnering relationships with other organizations. It plays a role of a transformer. It will transform different outcomes. CMHHK is also actively developing cooperations with organizations in the Chinese mainland and overseas. We are playing our role of going global. Since the commissioning of the CMHHK, its services are very well received by the public. The feedback has been positive. The government will continue to work with the operator of the CMHHK, will continue to provide more services. By the end of this year, we will go to the panel on health services and explain the operation of the two flagship institutions for CM development, that is CMHHK and the permanent premises of the government Chinese Medicine Testing Institute. We will provide a detailed report on CMHHK's first-year operation and its future service development plan. The lineup of members: Mr. Chen Pulang, Ms. Michelle Tang, Dr. Thomas So, Mr. Andrew Fan, and myself. Each member 4 minutes, including questions and answers. Mr. Chen Pulang, thank you. CMHHK has already started operation. It's been very popular among members of the public. Demands have been heard to increase service capacity. This shows that the role of CMHHK is very important in Hong Kong. With more services being provided by CMHHK alongside an increase in service capacity, there is pressure on manpower, especially TCM practitioners. Most TCM practitioners work in the private sector. In the future, if CMHHK is going to expand its services and service capacity, will private practice TCM practitioners go to the CMHHK, which will render private practice underserviced. There will not be enough TCM practitioners in private practice. Regarding graduates, how many TCM graduates will join the TCM sector upon graduation? Will supply meet demand? Regarding nurses, as I understand, there is no such specialty of TCM nurses. Nurses are trained under Western medicine with TCM elements. However, with the commissioning of CMHHK in the future, will there be specialized programs training TCM nurses? There is a shortage of nurses. With TCM being commissioned, there will even be burgeoning demand for TCM nurses, and some healthcare professionals will be snatched away from the market. So what measures does the administration have? Thank you. Undersecretary, thank you. I'm going to answer in brief. When it comes to manpower, I'd like to ask Professor Bian to give you more information. Regarding training, definitely we have nurse training, and we attach a lot of importance to it. I'm going to ask Ms. Leung to give you more information. By and large, when the Chinese Medicine Hospital of Hong Kong is commissioned, we engage different professionals according to demand, such as TCM practitioners, nurses, and these will be increased with the commissioning of the hospital. In private practice, there are sufficient professionals. According to the healthcare professionals' projection in 2023, there are manpower shortages in the short run, but in the long run, there will be sufficient manpower. When it comes to the healthcare projections, manpower projections 2026, we have already started our work, but I'd like to ask Professor Ben to give you more information regarding recruitment and manpower. Thank you. In the CMHHK, manpower is definitely our concern. Out of full operation, we have about 1,000 colleagues. At present, we only have 300. As we have started providing services, We are going to provide 24-hour inpatient services alongside 6 specialties. That's why we are implementing recruitment work full steam ahead. On the 9th of May, we had a Chinese Medicine Hospital of Hong Kong Recruitment Day. About 1,500 people attended this event. Our TCM practitioners come from the local trade. They form the core team of the CMHHK. We have seen a talent pool of CMHHK. The second part is that these professionals come from 3 local universities. The CMHHK is a teaching hospital of 3 universities in Hong Kong. Professors, tutors, lecturers come to the CMHHK to work. And the third part of the manpower comes from the local industry. We have staunch support from our country. Some service agreements have been signed with the CMHHK. Some TCM practitioners from the Chinese mainland come to the CMHHK for short-term training as well as other short-term teaching work. So far, the supply can meet the demand. Thank you. I'd like to ask Ms. Virginia Leung to provide more information in brief. Thank you. Regarding nurses, we are recruiting registered nurses in Hong Kong. They have a comprehensive background in nursing, and they are also well equipped with the relevant knowledge. When they are recruited, we will provide training for them. As Professor Ben mentioned, we have established service agreements with some key hospitals in the Chinese mainland. We have arranged for nurses to go to the Chinese Medicine Hospital in the Guangdong province. They will undertake courses, and they will also learn how to collaborate with TCM practitioners. Before the commissioning of the CMHHK, the CM Development Fund provide funds to train talent. There's a 1-year part-time program, and our targets are nurses. We have already started this program. Therefore, we have done different work to support nurses.
Ms. Michelle Tank. Thank you, Chairman. I thank the administration for the efforts on Chinese medicine development. I have 2 questions. First, on services of the CMHHK, you said that there are 5 missions to the CMHHK, namely healthcare services, training, education, research, collaboration, and creating health values. What does it mean by creating health value? Can you elaborate on that? I am very much concerned about allied health professional and the youth. I know that there will be a Chinese Medicine Testing Institute, GCMTI. What kind of talent do we need in the institution? Should we need experts in chemistry? Should we need Chinese medicine practitioners? I think that now is the time for us to nurture such talents. When students choose their majors, they need to know about the future that they have in Chinese medicine so that they can choose the right discipline. Thank you. Undersecretary can answer the question on CMHHK. Regarding the recruitment of GCMTI, we should save that for later because that's under the purview of Department of Health. That's not about the operation of CMHHK. It's not relevant to this agenda item because Dr. Mack has left. they will not need to answer this question. On creating health value, we want to encourage members of the public to know more about Chinese medicine. We will educate them about the use of Chinese medicine and clinical applications of it, and that's how we promote the health values of CM. After the establishment of the CMHHK, we will work on creating health values. Many members here have visited the hospital. At the people or the institutional level, we encourage everyone to know more about CM, and that's how we promote the health values of it. The hospital will, through evidence-based research, develop new clinical uses, widen clinical applications, and extend clinical outcomes of Chinese medicine through the hospital. And that's how we promote the health values of CM. Thank you. Next, Mr. Thomas So. Thank you, Chairman. I'm reading the paper. Paragraph 12 talks about how the hospital will fully leverage our advantage to support our country in promoting Chinese medicine to go global. I know that the administration has been working with the mainland on integrated Chinese Western medicine. I have a suggestion. As we promote CMHHK and Chinese medicine, we can work with the tourism industry. We can encourage foreign tourists to experience Chinese medicine. Foreigners are generally open about acupuncture. Some countries promote tourism plus body check. Should we not introduce this concept of Chinese medicine well-being? And this is how we can promote our culture in a soft way. Traditional Chinese medicine acupuncture is not the same as physiotherapy. The ICAC dedicated two floors of their building to promote tourism. So I think that we can do the same with Chinese medicine. Thank you. Undersecretary, thank you very much for your suggestion. For outpatient service, 35% are open for general members of the public to book a service. We do have some foreign users. As at April 2026, patients of CMHHK come from Germany, the Philippines, Malaysia, Indonesia, UK, US, Canada, Australia, France. There are altogether 64 of such patients from other countries. I will ask Professor Bian to elaborate on how we attract more foreign patients. Thank you. The Undersecretary is right. We have patients from 14 different countries. CMHHK is more than just a hospital. It is a photos-taking spot. Many people come just to visit the hospital and take photos. Apart from public healthcare service, we also want to provide private service in the Chinese medicine hospital. And that's how we promote CM to go global. Clinical pathways will benefit more people. We can share these clinical pathways that we formulate to many different professional bodies so that more people can make use of our model. After the hospital has been commissioned, we receive delegations from many different countries. And during the visit, we look into collaboration projects with them. Thank you. Mr. Andrew Fan. It is mentioned that CMHHK received patients from 14 different countries. The Undersecretary said that we are going to host international CM exchange and conferences. And the Chief Executive said that many people visit the hospital for photo taking. Should we not take this opportunity to host more international conferences to lay a solid foundation for our position as an international CM hub? I am a member of the Board of Directors of the Baptist University. Whenever the Board of Directors have meetings, we are offered Chinese medicine herbal tea. In other countries, when they have meetings, they offer fresh orange juice or apple juice. When people visit the Chinese medicine hospital, should we not offer hot tea to them? Should we not develop more Chinese medicine related products? Undersecretary, thank you. We want to enhance people's experience when they visit Chinese medicine. That's a hospital. That's a great suggestion. You suggested that we organize more international conferences. Let me briefly talk about what we've done. In 2025, together with Germany and Australian hospitals, we have signed strategic collaboration agreement. There will be continuing collaboration. In July this year, we're going to host a summit in the Chinese Medicine Hospital of Hong Kong. That's something that we will promote. Mr. Lee Chen-kan. Thank you, Chairman. The Chinese Medicine Hospital is rather remote, but many people told me that they were happy with the experience there. My family members visit the hospital all the time. They understand and appreciate the service level and environment of the hospital. And I think that this is the time for us to promote the technology that we have accumulated as well as our experience to the rest of the world. Hong Kong can play the role as a bridgehead. You said that you work with many different provinces and municipalities. Hong Kong's have this strong support of our motherland, and we're well connected with the rest of the world. How can we better connect with the rest of the world? Apart from attracting patients from other countries, how can we better connect with Chinese medicine practitioners along the Belt and Road or in other Southeast Asian places? Can we not invite celebrity Chinese medicine practitioners to Hong Kong for exchanges? I just learned that there are different level of charges and fees in CMHHK, and it's faster for people to receive service if they pay a higher fee. The hospital offers many different services. Can we not accord an extra tier that is more affordable in the middle? It is mentioned that we want to promote CM globally. We visited Shanxi together with the chairman on the mainland. I think that the GCMTI and the CMHHK can work together on certification and testing of herbs and Chinese medicine, so that we can accord different grading to different Chinese medicine. Again, Dr. Mack from the GCMTI have left. I'd like to know about the role of CMHHK. Thank you. Undersecretary. Regarding the operation of CMHHK and whether we should invite experts from our country. Professor Bian will elaborate on that later on. With regards fees and charges, we will make announcement when there is any changes. Conceptually speaking, we will make sure that people find it convenient to use the hospital, and there will be different subsidy model. We will make our fees and charges transparent. We may offer a package treatment plan so that patients don't have to pay here and there for different tests and treatment. Professor Bian will explain about the operation of the CMHHK. Thank you. The goal of the Chinese Medicine Hospital is to serve the Chinese medicine development in Hong Kong. We hope that it will serve as a bridgehead for Chinese medicine to go global. We may invite national Chinese medicine masters to Hong Kong. And we hope that the Chinese Medicine Hospital of Hong Kong will be a platform for exchange and demonstration. We want to foster exchanges and collaboration. From 4th to 5th in July, we're going to have a Hong Kong summit on Chinese medicine. We have invited international experts to the summit, but we'll continue to host more conferences and summit. And hopefully Hong Kong can become a platform for Chinese medicine development. Thank you. Thank you, Professor Bian. Chairman, I have a follow-up question. Professor Bian said that they proactively organize international exchanges and conferences. We hope that the CMHHK will foster Chinese and Western medicine collaboration. I think that we can perhaps invite Western physiotherapists to come to Hong Kong. We can promote acupuncture to them. Thank you. Professor Bian, any reply? Thank you very much. Chinese medicine is a discipline with great history, and we also want to foster Chinese and Western medicine collaboration. We are going to promote this model to not just locally, but also to the rest of the world. And that's one of our objectives. Thank you.
Next member, Mr. Peter Shield. Thank you, Chairman. The CMHHK has been commissioned. This is indeed a piece of good news. I believe members of the Council definitely support the development of the CMHHK. I'd like to ask about paragraph number 6. The government has increased 3 times the quota for the government-subsidized outpatient services. We can see that the demand is huge. Can we cope with the demand? If we can't, what is the way forward? Undersecretary, thank you. I'd like to ask Professor Bian to provide more information about this. I thank member for his support. Manpower, public demand, we have been increasing service capacity based on these factors. We're also continuing to provide inpatient services and day patient services. Regarding quotas, I'd like to ask Professor Bian to give you more information. Thank you, Professor. Thank you, Chairman. I thank the government's and the Council's support. We will definitely do well day patient services. And we will also provide 24-hour inpatient services. We have increased 3 times the quota. Subject to the approval of the Board of Directors, we have applied for the 4th time an increase in service capacity, and on the 13th of May, this has been approved. So we're going to provide more services to even more members of the public. Through increasing the number of beds as well as general outpatient clinic and specialized outpatient clinic, we expect to provide even better services to members of the public. Thank you. Mr. Shill, I believe the demand for TCM services will only grow. A lot of people will come to the CMHHK owing to the reputation of these TCM. So when the speed picks up, we can expect that when many members of the public flock to CMHHK, how can we cope with the demand? We need to expedite the provision of TCM services in other clinics, so patients do not have to travel afar to come to the CMHHK. Thank you. And my time, I'd like to briefly follow up on the following matters. First of all, I'd like to say that I'm happy to see that TCM services provided by the CMHHK are very popular, and in December this year, 24-hour inpatient services will be provided by the CMHHK. Earlier on in a media interview, the CMHHK said that they would discuss with the administration increasing service capacity, so I'd like to know whether manpower is sufficient to cope with the future demand. CMHHK has a total of 5 missions, so I'd like to ask the administration to tell us, in addition to healthcare services, teaching, research, training, collaboration, I'd like the CMHHK to tell us the latest progress. Thank you. In a moment, I'm going to ask Professor Ben to give you more information. But as we said, the public has a huge demand for CMHHK services. We will coordinate DCH to provide sufficient services to members of the public in society. We are discussing the quota for government-subsidized service quotas and market-oriented service quotas. The main purpose is to ensure service quality, safety, and good experience for patients. So regarding manpower, I'm going to ask Professor Ben to explain. Thank you. Regarding manpower, we have 300 staff members. Full establishment will stand at 1,000. On the 8th and 9th of May this month, we held the recruitment day of the CMHHK. Over 1,000 people came to the recruitment day, and we are taking forward our recruitment efforts full steam ahead, not least TCM nurses. Our progress has been smooth. That's about manpower. Turning to our core missions 5+1, healthcare, teaching, research, collaboration, creating health value. These are our 6 main missions. I'd like to talk about outpatient clinic services. That is day patient, inpatient services. These are exactly our focuses. Regarding teaching, 3 tiers. 1, on the 9th of September last year, we worked with Hong Kong UCUHK and BUHK to sign teaching agreement. CMHHK is the teaching hospital for all 3 universities. This September, clinical practicum will start in the CMHHK this year. In addition to TCM, nursing, physiotherapy, they do want to have practicum experience at the CMHK. We are discussing with the relevant universities. Regarding training, we have already started, and this is the second tier training. Regarding the third tier training, we provide continuous training for the industry. So for 3 years running, we're going to hold a large number of continuous learning and continuous education programs. CMHK has a special facility, not just phase 1 and phase 2. Our focus is the traditional theories of TCM as well as the complementarity between the Western and Chinese medicine. We want to use the CMHK as a platform so that we can continue to collaborate together to promote research of TCM. Regarding collaboration, we have already worked with 10 Chinese mainland institutions. We have signed service agreements with these institutions as well as those in Germany and Australia. We will work together to promote TCM. We'll tell the good stories of traditional Chinese medicine. Regarding the creation of health value, we want to help patients so that they will receive clinical treatment in a safe manner. We also want to help the industry and the public. We want to let the public know the importance of health value. We will work in a tripartite collaboration that is teaching, healthcare, and research. Thank you. Next agenda item. Any other business? According to the document issued to members earlier on, at the next meeting, which will be scheduled for the end of June and the start of July, we're going to discuss 3 matters: regulatory system, industry development, and global trade promotion measures for CHM, as well as implementation of the Hong Kong Guide to GMP and the role of work plan of the GCMTI. Any views? If no, we're going to discuss with the Secretariat the date and time, and then we're going to inform members of the details of the next meeting. There being no other business, meeting adjourned. Thank you, members. Thank you, officials. Thank you, Secretary. Thank you.